Do you know what tuberculosis is and how it affects people around the world? Well, today we delve into this global health issue, aiming to shed light on its causes, risk factors, and overall impact. Tuberculosis, often referred to as TB, is a serious infectious disease that primarily affects the lungs. However, it can also impact other parts of the body, including the kidneys, spine, and brain. It is caused by a bacterium called Mycobacterium tuberculosis. Now you might be wondering, how does one get infected with tuberculosis? The disease spreads from person to person through tiny droplets released into the air via coughs and sneezes. It's important to note that it's not easy to catch TB. It usually comes from prolonged exposure to someone with the illness. Brief contacts generally do not spread the disease. Now, onto the main points about tuberculosis. Firstly, it's crucial to understand that not everyone infected with the TB bacteria becomes sick. There's a condition called latent tuberculosis. In this state, you have the bacteria in your body, but your immune system keeps it from turning into the disease. People with latent TB don't feel sick, nor can they spread the disease to others. However, they may develop TB disease if they do not receive treatment for latent TB. On the other hand, there's TB disease, which occurs when the immune system can't stop the bacteria from growing. People with TB disease are sick and can spread the disease to others. They need medical help right away. Now, let's talk about risk factors. Certain conditions can increase the risk of turning latent TB into active TB. These include HIV/AIDS, diabetes, certain types of cancer, and drugs designed to prevent rejection of transplanted organs. Additionally, people who are malnourished or who use tobacco are at a higher risk. In conclusion, tuberculosis is a serious global health issue that requires our attention. Understanding what it is, how it spreads, and its risk factors is the first step in combating this disease. So, if you find yourself in a situation where you might be at risk, seek medical help immediately. Remember, knowledge is our best defense against diseases like tuberculosis.